The name the Ruby Princess cruise ship has come up yet again, contributing to the incidence of coronavirus in Australia. It comes as some states and territories announce further easing of restrictions. Here are today's key developments in our coronavirus coverage. So there's been another virus death in Tasmania, while a report into the coronavirus outbreak in the state's northwest has found it most likely originated from the Ruby Princess cruise ship. In the Northern Territory, restrictions limiting attendees at outdoor weddings and funerals will be lifted from tomorrow. There'll be no limits on the numbers so long as people maintain social distancing. Playgrounds, parks and reserves will also reopen in the Territory. Blood purportedly harvested from recovered coronavirus patients is being offered on the dark web as a vaccine. ANU research has also found medical equipment, including ventilators, being sold offline. The US economy has shrunk by almost 5% in the first quarter, the most severe contraction in more than a decade. Analysts are warning that by June, that figure could be 20% or more. And in the UK, the death toll has passed 26,000. Britain now has the third worst death toll behind the US and Italy. So let's take a look at those elements in detail now. An internal investigation into a coronavirus cluster in the northwest of Tasmania has found some staff who were infectious worked in local hospitals for several days while experiencing symptoms. Tasmania's Director of Public Health says the outbreak at the Northwest Regional and Northwest private hospitals most likely began when a Ruby Princess passenger with COVID-19 transmitted the infection to staff, who then passed it to other workers and patients at two hospitals. Reporter Erin Cooper has more.
This report into the Northwest Regional and Northwest private hospitals, which are behind me here, was, as you say, released very, very recently. The Premier said that, yes, the most likely reason for the outbreak was because of the Ruby Princess cruise ship. He referred to it as ground zero, and maybe a patient there has transmitted it throughout a lot of healthcare workers here. So far, there have been 136 total cases of coronavirus in Northwest Tasmania, and that includes 81 healthcare workers. Of course, that prompted both hospitals to be completely closed and up to 5,000 people forced into 2-week quarantine while that deep cleaning continued. Now, Mr Gutman, when explaining the report this morning, he was at pains to stress that no one was to blame for this. Healthcare workers weren't to blame, Ruby Princess passengers weren't to blame, and this was about understanding how to better control infections. He said in this case that the strong work ethic of Tasmanians maybe worked against them, and anyone with the slightest sniffle just shouldn't go to work.
And Erin, what's the situation like at the hospital now? And we've only just heard this word about kind of how the virus was spread through staff as well. You may not have had an opportunity to actually see the report yet because it's only just been released online. But yeah, can you talk us through the situation at the hospital now and any detail about how it was transmitted through staff as well?
Well, at the hospital today, it was handed back to staff yesterday from Australian Defence Force and AUSMAT personnel. They were here for 2-3 weeks while all of those healthcare workers were in quarantine. The rest of the hospital remains closed, but the emergency department and emergency maternity has reopened. As to how the virus spread throughout staff, Peter Gutman did say this morning that we may never know exactly how it spread as far and as fast as it did. I haven't gotten a chance yet to read the actual report, which likely contains a lot more detail and contact tracing information, but that's certainly what Peter Gutman had to say.
Erin Cooper reporting there from Burnie on the northwest coast of Tasmania. Victorian authorities are investigating a new coronavirus cluster linked to an aged care facility in Melbourne's east. There are 7 new cases in the state, bringing this total to 1,361. 3 residents and 1 staff member at Hawthorn Grange aged care facility have tested positive to COVID-19. The Victorian Minister for Ageing and Carers, Luke Donnellan, says a thorough investigation into the cluster is underway.
Obviously, the Chief Health Officer and also the specialists in our aged care division will actually be down there today, provide support to that private sector facility to ensure that 1, that there'll be testing, 2, that there'll be tracing and ensuring there's deep cleaning going on. But obviously it's being investigated. We don't have the numbers presently, so that's why we're undertaking that investigation. But obviously we'll be there today doing that work that needs to be done. In terms of our public sector aged care service has been engaged with across the board, not just our public sector aged care facilities, but also the private sector, to ensure that the messaging in terms of visitors, in terms of the guidelines and the like, are presented to all to ensure that we actually get the very best outcome we have. And to be blunt, to date we haven't had outbreaks like in New South Wales. I very much hope that that remains like that, but very happy to come back to you a little bit later on today with more specifics. It's very early on, so I'm a little bit reluctant to make prognosis of how management has managed residents there without actually knowing what's gone on.
Victorian Minister Luke Donnellan there. Several coronavirus restrictions will be eased for parts of the country in coming days. In New South Wales from tomorrow, 2 adults will be able to visit someone else in their home. And there are announcements in Tassie and the Northern Territory today as well. Reporter Lara Hyams has more from Sydney.
We're starting to see these restrictions eased in New South Wales, also Queensland, and Tasmania has also intimated that it's likely to ease some of those restrictions in the next 24 hours. But the most detail that we've had at the moment has been from the Northern Territory. Now, they're looking to ease some restrictions by tomorrow. This will focus on parks and water parks as well, also some of the opening spaces, swimming pools as well. But it appears that if those facilities are council operated, it will be up to those individual councils to work out how they actually execute that plan. But it will be the government which will be easing the pressure on that. Of course, patrons are still reminded that social distancing will be in place, so patrons will still need to exercise that 1.5 distance between each other, and it will be up to the facilities to have upgraded hygiene facilities there. We believe that the Chief Minister, Michael Gunner, will be outlining a timeline later today, some specifics as to how that will be executed. It won't be a full resumption of services, but it is a step in the right direction to lifting some of those sanctions that we have been seeing. Also, New South Wales tomorrow will now allow 2 adults to visit another home, and we're starting to see some retailers also opening up their doors, allowing consumers to start up their shopping and buying again. However, the Premier has warned that vigilance needs to be exercised by all those involved.
We know today is the last day of the restrictions that we'd had in place for the month of April, and tomorrow there are a slight easing of some of the restrictions. And I want to please say to everybody, please do this responsibly. We appreciate that for mental health and to reduce isolation, people are now allowed to go and visit others in their home, 2 adults at a time. But please make sure you do this responsibly. We don't want to see a huge spike in cases, which makes the situation unmanageable, and then for us to revert back to what April looked like.
Her comments come as she announced that there had been 2 new cases of coronavirus in New South Wales, and that comes after 7,000 tests were carried out yesterday.
The World Health Organization has confirmed it's investigating a rare inflammatory condition found in children, which is possibly linked to the new coronavirus. It's thought to be similar to Kawasaki's disease or toxic shock syndrome and has been identified in the UK. The WHO says the syndrome appears to be very rare.
We do know so far with regards to children that continuing in our understanding of this, that data from this disease in children, they tend to have less severe disease, so they tend to have overwhelmingly mild disease, but there are some children who have developed severe disease and some children who have died. There are some recent rare descriptions of children in some European countries that have had this inflammatory syndrome, which is similar to the Kawasaki syndrome, but it seems to be very rare. What we've asked for is for the global network of clinicians to be on alert for this and to ensure that they capture information on children systematically so that we could better understand what is occurring in children and so that we could better improve our understanding and guide treatment. But it seems to be very rare and only in maybe 1 or 2 countries so far.
US President Donald Trump says the US government will not be extending coronavirus social distancing guidelines once they expire this week. There are more than 1 million confirmed coronavirus cases in the US with 61,000 deaths. The president says he predicts a great economic rebound in coming months and claims the country will soon be performing 5 million tests for COVID-19 a day.
Well, thank you very much, everybody. A lot of progress is being made, as you see. And we're reopening our country, and it's very exciting. And it should have never happened. This plague should never have happened. It could have been stopped, but people chose not to stop it. And it's a very sad thing for the world, 184 countries at least. But it's a great honor to have you with us, friends of mine, who have been truly great business leaders and are great business leaders. And you're opening up your company again, too, if you think about it, right? You're sort of doing a reopening, but they're great companies and they'll do very well, hopefully better than ever before. And that's what we're seeing. We're seeing tremendous pent-up demand. And it's a beautiful thing to see. So it's wonderful to have America industry leaders, and that's what you are, true leaders, to the White House. You've been here before, all of you, and we've talked about it in different times. We built the greatest economy in the history of the world, and nobody even disputes that. And one day they walk in, they say, sir, we're going to have to close it up until we get rid of this hidden enemy, this terrible scourge. And that's what we did, and we did the right thing. We did an incredible job. We worked with the governments. We worked with states all over the country. We had no ventilators, or very few, from previous administrations, and we became the king of ventilators. We have thousands and thousands of ventilators. We're now helping other countries with ventilators. We had old-fashioned tests that didn't work. They were really obsolete. They didn't work. They were broken. And we end up, the testing has been incredible now, and to a level that nobody's seen. I got a call from President Moon of South Korea. He said, congratulations, your testing is just, nobody's ever seen anything like we're doing. We've tested more than all countries put together, and millions of tests, and the highest quality test.
The chief of the World Health Organization has defended the agency's record and its response to coronavirus. The Geneva-based UN body has faced criticism in recent weeks, mainly from the US, which has cut funding. The agency's chief says the WHO has acted efficiently.
From the beginning, WHO has acted quickly and decisively to respond and to warn the world. We sounded the alarm early, and we sounded it often. We said repeatedly that the world had a window of opportunity to prepare and to prevent widespread community transmission. People were saying, the world would be tired of you if you're making a press conference every day. But we didn't mind. We wanted to make sure that the world understands what we're saying.
Scuffles have broken out between police and Peruvians attempting to return home after being stranded when the coronavirus lockdown went into effect last month. Dozens of people have blocked streets demanding transportation home. Some residents, including the elderly and children, have spent 2 weeks camping on the streets in precarious conditions as they await permission to travel. Brazilian President Jair Bolsonaro has sparked anger after answering "so what" when asked about the country's coronavirus death toll. Brazil has more than 73,000 cases, with at least 5,000 people dead. Mr Bolsonaro says he regrets the number of deaths, but says he can't perform miracles. And I noticed another story this morning about this, about the city of Manaus, deep in the Amazon. They're burying people 5 at a time there. Because they just have to refine that process because they just can't handle the numbers of people dying there at the moment. Long after the coronavirus pandemic subsides, the economic pain of the shutdowns will continue to be felt for many regional areas recovering from drought and bushfires. It's a lot to overcome. The Mayor of Dubbo in New South Wales, Ben Shields, says businesses are doing it tough at the moment.
Regional New South Wales, we haven't had a double whammy, we've had a triple whammy. We've had the drought, we've had the fires, and now we've got this virus. And look, a place like Dubbo, we really do it tough because, a lot of people don't understand that Dubbo actually exists to be a service centre for Western New South Wales. And, we may only have a population of 50,000 people, but 130,000 people all do their shopping and their business and whatnot in Dubbo. And with all these travel restrictions and with everyone being told to stick to their homes and their little towns and things like that, Dubbo businesses are doing it very, very tough at the moment. So the coronavirus is knocking us around significantly, and I suspect that would be the case in cities right around regional New South Wales, in fact right around regional Australia, when we've just had these so many issues that's come up over the last the last 12 months. It's just been extraordinary what sort of hits we've been having. We're doing quite well actually, the lockdown. I've been extremely pleased with how Dubbo people are taking this. They've got right behind it. They're staying at home. Our businesses are being so responsible too. I've seen that they're really out there with the disinfectants and all that sort of stuff. A lot of businesses have closed. Our business surviving and thriving is so important. But I will point out, so far the only people who are calling for various regions being opened up again are politicians. I haven't seen a chief medical officer, or I haven't seen a medical researcher or anyone who actually knows what they're talking about saying open up the regions, and that's the thing that I find extraordinary. Now, if there was a chief medical officer or someone who knows what they're talking about makes that suggestion, well, I think it might be a good idea. But if it's just politicians out there trying to score points and big note themselves, no, I'm not interested. Dubbo or regional Australia shouldn't be a test case and shouldn't be treated as second-class citizens for Sydney and capital areas. So once we start seeing some experts come out, and not the politicians carrying on like politicians usually do, we'll have a look at it then. After being a service hub, Dubbo's next way we make money effectively is tourism. Western Plains Zoo, we've got the best zoo in Australia. We've got fantastic tourist facilities like the old Dubbo Jail and the Wellington Caves, things like that. Now, we survive on that as well. We really do need those tourists coming back. And, Dubbo is such an iconic destination now. We're only not that far from Sydney. We've almost got it, well, when the flights are running, almost got a flight coming into Dubbo every hour from Sydney. It's very important that these guys continue to flourish and grow, and our domestic tourism market continues to grow. And, Dubbo being seen as a family's destination, we really need that to return. So my encouragement to the federal and state government is, when you're looking at those stimulus packages, once this lockdown has been opened again, look at these, don't just look at the big capitals, the Gold Coast and things like that. Look at those important regional centres like your Dubbos and places around that survive on tourism just as much as what the big guys do. It's very, very important that they remain open and that we remain viable.